When the Supreme Court tossed out certain provisions of a Texas abortion safety law earlier this year in Whole Women's Health versus Hellerstadt, it did so without considering the conditions that exist in Texas abortion facilities that prompted the passage of the contested legislation in the first place. Operation Rescue now has evidence that proves substandard conditions and practices at Texas abortion facilities continue to pose a significant danger to the lives and health of women. The most recent inspection reports for each Texas abortion mill obtained by Operation Rescue from the Texas Department of State Health Services document serious safety and sanitation concerns. You see, in Texas, ambulatory surgical centers and abortion facilities are required to submit to annual inspections. However, they do not appear to be required to pass the inspections in order to be licensed or have their licenses renewed. Abortion mills are required to submit a plan of correction, but there's no evidence that any follow-up visit ever took place to ensure the often egregious violations were ever corrected. Here are the facts. Of the 17 abortion businesses, 8 are licensed as ambulatory surgical centers and are required to meet stricter standards than the remaining 9 facilities, which are licensed as just abortion facilities. Only 1 abortion facility out of 17 was found to be in compliance during inspections that took place between August 2015 and June 2016. 13 of the 17 facilities failed to ensure infection control protocols followed in order to prevent the spread of infectious diseases. Proper hand washing was a particular concern. In 10 out of the 17 abortion clinics, protocols involving the use, testing, and maintenance of the autoclave where surgical instruments are sterilized were not even followed. That means contaminated surgical instruments have been used on women, some of whom develop post-operative infections. Inspectors found drug handling violations at 10 of the 17 abortion clinics, which compromised the health of patients. In 15 of the 17 abortion clinics, staff were inadequately trained or ignored important protocols and policies that were supposed to ensure patient safety. 12 of the 17 facilities kept shoddy records that reflected deficiencies in patient care. And other violations of note within the reports include failure to post required information where complaints could be filed against the facility, failure to report child abuse on a minor patient, failure to observe mandatory waiting periods, failure to examine women prior to the surgical procedure, cracked and or contaminated vaginal ultrasound probes, cross-contamination of instruments and supplies with aborted baby remains. It is now obvious that regulatory reforms are needed to protect women from the serious health dangers posed by Texas abortion clinics. It may have been beneficial for the Supreme Court justices to have reviewed these documents prior to declaring common sense safety provisions to be an undue burden. An animal should not be subjected to such abuse, much less a pregnant woman and her baby. Now, it is obvious that regulatory reforms are desperately needed to protect women from the serious health dangers that continue to exist at abortion facilities in Texas. Abortion facilities should be required not only to submit to inspections, but also required to pass them before ambulatory surgical facility or abortion facility licenses are issued or renewed. For more about these abortion facility violations, visit OperationRescue.org. And thanks for watching, and please like, subscribe, and share on your way out.